All right, let's talk about two really common medications you hear about a lot, gabapentin and lamotrigine. Now, you might think they're kind of the same thing, right? I mean, they're both anticonvulsants, so their job is to quiet things down in the brain. But that's where the similarities pretty much end. How they do that job and what they're used for are totally different stories. So let's dive in and unpack this.
So here's how we're going to break it down. First, we'll meet the contenders. Then we'll pop the hood and see how they actually work. After that, we'll get into the main event, what they're really used for. Of course, we gotta cover the fine print, side effects, and warnings. And finally, we'll wrap it all up with the big takeaway.
Okay, first things first, let's get a proper introduction to these two. Who are they, really? So, we've got gabapentin, which you've probably heard of by brand names like Neurontin. Now, it's called a GABA analog, which sounds fancy, but it just means it kind of looks like GABA. That's a key chemical that helps chill out your brain. But here's the really interesting part, a total head-scratcher. It doesn't actually work on GABA receptors. Its real magic trick is something else entirely, and we'll get to that in just a bit. And then, in the other corner, we have lamotrigine, which you'll often see as Lamictal. This one's a triazine derivative, a totally different chemical family. So, right off the bat, you know we're dealing with two completely separate approaches. These aren't just two flavors of the same thing. They're different tools for different jobs. Okay, so if they're both supposed to calm down the brain's electrical storms, how do they do it? Well, this is where things get really interesting and where you start to see why they're used so differently. This right here, this is the core difference. Imagine a nerve cell that's just firing way too much, like a room where the lights are flickering like crazy. Gabapentin comes in and works on the calcium channels. It's like it finds a dimmer switch and just turns everything down, reducing the release of a bunch of those go-go-go neurotransmitters. Lamotrigine, on the other hand, goes for a different switch entirely, the sodium channel. It basically flips that switch off, which specifically slams the brakes on glutamate, one of the brain's biggest gas pedals. So yeah, two different switches, two very different results.
So, because they work in such different ways, it makes perfect sense that doctors use them for different things, right? Even though there's a little bit of overlap. Let's take a look.
And this chart lays it out perfectly. See that check mark for seizures on both? That's their common ground. But from there, they really specialize. Lamotrigine is a powerhouse for managing bipolar I disorder, really helping to keep moods stable for the long haul. Gabapentin, its claim to fame is more in the world of nerve pain. We're talking that awful pain that can linger after shingles. And, for one specific brand, even restless leg syndrome.
All right, time for the fine print. You can't talk about medications without talking about side effects and, the really important warnings you absolutely need to know. With gabapentin, the side effects make a lot of sense when you think about what it does. It's calming down the central nervous system, so you're going to see things like dizziness, drowsiness, just feeling tired. For some people, it can also cause anxiety or even some weight gain.
Now, lamotrigine has its own list. Headache, maybe some trouble sleeping. But look, there's one word on this list that's in a league of its own: rash. And I want to be super clear, we're not talking about a little bit of dry skin here. This is a huge potential red flag, and we're going to dive into exactly why right now. But hang on, before we get to the unique warnings, there's a really serious one they both share. It's a risk that comes with a lot of anti-epileptic drugs, and it's an increased risk of suicidal thoughts or behaviors. This is a big deal. It means that anyone on these medications and the people around them need to be really vigilant and in close contact with their doctor.
Okay, let's circle back to that rash with lamotrigine. This is, without a doubt, its most critical warning. In rare situations, a rash can be the first sign of a very dangerous, potentially fatal condition called Stevens-Johnson syndrome. We're talking about severe blistering and peeling of the skin. The risk goes way up if the dose is increased too quickly or if it's taken with another specific drug, valproate. The bottom line here is crystal clear. If you are on lamotrigine and you get a rash, any rash, you call your doctor immediately. No exceptions.
Now, gabapentin's biggest warning is on a different track, but it's just as serious. That drowsiness and dizziness we mentioned, it can be really significant. We're not just talking about feeling a bit tired in the afternoon. We're talking about a level of sedation that can make driving a car or using heavy machinery incredibly dangerous. It's a major safety concern that you have to respect.
And this brings us to another huge point of difference, how they play with other drugs. Gabapentin is pretty chill in this department. It's not processed by the liver, so it tends to stay in its own lane and not interact with a lot of other medications. The main thing to watch out for is just piling on the sleepiness, so mixing it with alcohol or strong painkillers is a bad idea. Lamotrigine, well, it's a whole different ballgame. It's much more sensitive. Other drugs can really mess with its levels. We already mentioned valproic acid. That's the big one that skyrockets the rash risk. But other meds can actually lower lamotrigine's effectiveness too.
Okay, that was a lot to take in. So let's pull it all together. What are the absolute key takeaways when you put these two side by side?
This table really nails it, doesn't it? You can see it all at a glance. Different classes, different mechanisms, calcium channels versus sodium channels, totally different unique uses, nerve pain for one, bipolar disorder for the other, and those huge distinct warnings, driving impairment for gabapentin and that severe rash for lamotrigine. It's also worth noting they're both pregnancy category C, meaning the risks aren't zero, and it's a super important conversation to have with a doctor if you're pregnant or planning to be.
So there you have it. Two drugs, both called anticonvulsants, but they are worlds apart. It's a great reminder that a label is just a starting point. The real story, the part that actually matters, is in the details. How it works, what it's for, and what to watch out for. And knowing that difference, that's everything when it comes to using these powerful medications the right way.